Hello, I'm Dr. Jerry Montaigne with Health by Lights. I want to talk about the Super Pulse laser and how to use it for wrist and hand problems. The Super Pulse laser has 3 different nanometers. It has a 660 nanometer, an 875 nanometer, and a 905 nanometer. What does that mean? This chart here shows this is the device here, this is the skin down here. A 660 nanometer light will go to a certain depth into the skin, but an 875 will go deeper, and the 905 will go even deeper. The 905 is a true laser frequency. So using all 3 of them, it's going to cover that whole range and give treatment to that whole range of area. The 905 being a laser, you have to make it safe or it'll burn you, so it has the pulsating. This is the first device that was certified by the FDA for sale over the counter to the patients. So it's the first thing that's come around where you can actually buy and take home in a laser aspect. So having those 3 nanometers that'll go deeper for you is one factor. This has pulsating to be able, that's why it's called a super pulse laser. That's to be able to prevent the laser from burning you. So it has 3 different frequencies of the pulsating. Number 1, mode 1 is 50 hertz, mode 2 is 250 hertz, and mode 3 it scans from 1000 to 5000 hertz. So it'll go back and forth. You put it up by your ear when it's scanning, you can actually hear it. It'll hum to you. Now, what does that mean? That just means that the different frequencies it's doing, it will cause the body to do different things. Now, these are the unscientific approaches to it. If you want the scientific things, you can go to the website. There's a lot of information there on the scientific aspect. But I'm talking to those who really don't care as far as just tell me how it works, but why it works and what to do with it. So, mode 1 on this is for general health. Brings circulation to the area, helps relax the muscles and this type of thing. Mode 2 is good for stiffness and general and promoting health, and I like it for regeneration or rejuvenation. And then mode 3 is what they call inhibiting, getting rid of. I have pain, I have muscle spasm, I have a bug bite that I want to get rid of the itching. Anything you want to get rid of. I have sinus headache, so I'll put it over the sinuses to get rid of the headache. Anytime you want that, that's mode 3. So let's talk about the wrist. Let's say that say I have a carpal tunnel and it's hurting in here, so I have pain. So I will go to mode 3 because I want to get rid of pain. I will push the on-off button and it's flashing, and then I will treat it in the area. Now, you want to treat over the pain, and you want to always treat directly to the skin, not through any kind of clothing. You want to put a little bit of pressure. You don't have to bear down, but you put some pressure because the blood will absorb the biggest percentage of the light energy. So if you put a little bit of pressure, that stops the blood from flowing underneath it so much, and you can get deeper into the body. So you'd hold it there for 2, 3, 5 minutes, and then you go to the other side. But you need to realize what I like to do, and the reason you have to, light therapy, you want to envelop the whole area. So if I'm having trouble with the wrist or the thumb or anything like that, I'm going to treat the area, 2, 3, 5 minutes, I'm going to treat the area, and then I'm going to go all around and even down in the fingers and maybe even up as far up as the elbow. Get healing energy throughout the whole area. It's not like an ultrasound or electric stim where you just treat the area and go with it. You want to envelop the whole area is what it amounts to. I had somebody that had circulation problems because he'd had chemotherapy for a kidney cancer. And it was like 3 or 4 years after he had done with his treatment, and his hands were cold, just like ice. So I treated him, and I started at his fingers, both sides, and then I went up, all the way up to his elbow. When I was done, his hand was warm. One hand was warm, the other one wasn't, so I treated the other hand. And he had heat. Talked to him 6 weeks later, they were still warm. So treating and moving your way up, or surrounding that area is what you want to do. That's the main thing with wrist, hand, anything along that aspect is what you want to do. I use number 3 if it's in pain. You use mode number 1 if you want general health. You know, let's say you have pain today and you're going to use number 3. Tomorrow, it's not as painful, but it's still pretty stiff. You may want to use number 3 again. Then the next day, number 2 to get rid of the stiffness. After it's like, well, it's feeling really good, but I just want to make sure it continues healing, then you'd use number 1. So 3 to get rid of pain, 2 to get rid of stiffness, 1 just for general healing. Now, don't get me wrong. You can use any of the modes and you're not going to hurt yourself. You know, that's the main thing you need to realize. It's just if you know how to use the different modes, you can get a little better results quicker by knowing it. But just using the thing, just put on mode 1 and use it, you're just going to see some fantastic results. Because again, it will go deeper than most devices because it has the 3 different nanometers, because it's actually a true laser set up to be safe for use at home. I'm Dr. Jerry Matine with Health by Light. If you have any questions, contact me at the website. Send me the question. We'll try to get it answered for you. Thanks for listening. Stay in good health.